It's Congressman Jamie Raskin from Maryland's beautiful 8th Congressional District coming to you this Friday the 13th, October 13th, for my favorite time of the week, Local Hero, when we get to recognize the people who are making life in our community so wonderful and so rich. Today's Local Hero is David Del Pozo, who is the head of Montgomery County's Latino Health Initiative. This is our final segment of Local Hero for Hispanic Heritage Month. And we're delighted, David, to recognize you for all of your extraordinary work. Congratulations on being our local hero, and welcome to our segment.
Thanks so much for having me.
And let me say a few more words about what you do. David is the program manager for MoCo's Latino Health Initiative, the son of Ecuadorian immigrants. He's worked for 7 years with the initiative, which is part of Montgomery County's Department of Health and Human Services, promoting equitable access to health resources for everybody in the community. David was involved in early efforts to deliver community-based COVID-19 testing, targeting communities that were vulnerable and in need, working with faith-based groups, residential complexes, and other partners to reach everybody. He's also helped develop the Community Health Worker Training Program, which trains in Spanish public health advocates and champions to enhance health access for underserved communities. Very passionate about the intersection between health and climate change, and has been working with community partners to help make our community more climate resilient and more climate ready. He's been in Silver Spring for 13 years. He and his wife, Lisa, are the proud parents of 2 children, ages 14 and 12, 2 dogs and a cat. So again, welcome, David, and thanks for everything that you do.
So happy to be here. Thank you for making some time for me today.
Let's start for a moment about COVID-19. How would you describe where we are in that crisis? Because I know you've been involved for a long time now in helping to ready the community to deal with it.
You know, obviously, we're still in the midst of it. Certainly better off than we were a couple of years back. A lot of effort has gone into communicating and engaging the community here in Montgomery County, in particular the Latino community, about the impacts of COVID, how we can stay safe, healthy. This obviously has an impact on our abilities to provide for our families, to go to work, to just have a quality of life that we all hopefully are able to achieve. And so even though the rates have gone down, obviously we're far beyond the early days, it's still an issue, and kids are missing school again. This happened just a couple of weeks back with the start of the school year. Announcements going out through the school system about rising cases. So it's just a reminder for all of us to continue to be vigilant and to take our health and the health of our community seriously. Obviously, when you are when you're wearing a mask, you're protecting yourself, you're protecting others. It's sort of the ultimate service that you can do to help us all stay safe and healthy. So that's work that's ongoing. We're still, promoting the testing and vaccination effort to take place here in the county, and that people tap into those resources so that they can keep themselves and their families safe.
Yeah. How would you describe the character of healthcare needs within the Latino community, which you focus on? Is it related to access to information and knowledge? Is it a question of economic resources, or is it language barriers? How would you characterize what the major obstacles are to getting people the healthcare they need?
Yeah, I think that there's a lot of those factors that you just mentioned, but the one that I would highlight is just sort of the matter of trust. And so getting information that's solid information from a trusted source, having access to healthcare providers that they have some type of relationship with, or again, trust with. We've spent a lot of time promoting health prevention measures and information about myths and about the vaccines. And it's just something that has to be a steady drumbeat of information that's going out, because all it takes is somebody to have a slightly different perspective on it, and then that mucks things up. When we are coordinated with our clinical partners and community partners and government partners, and we're able to deliver a concise and clear message to the community, then they're able to act upon that so that they can stay safe and healthy. So the trust issue, I think, is really key. We accomplished that here in the county through communications that are in Spanish, is in terms of reaching out to the Latino community. But obviously, in a county and community as diverse as ours, there are lots of different language needs, and so working across agencies to ensure that all communities are getting reliable information, where they can go to get a test, or where they can get a vaccine, how to get an appointment. These kinds of things are important to make sure that we all stay healthy.
Yeah, well, what a great insight to share with everybody, that you're kind of in the trust building business by giving people a sense of confidence in the information and the facts and the knowledge that government is able to share with them, and then figure out the right channels for receiving the right services. I know that you're very passionate, not just about public health, but also about climate change and the various effects that they have on our social and human environment. Tell me how you combine that focus on climate into your work on healthcare.
So the work and the mission of the Latino Health Initiative here in Montgomery County is to address the health disparities impacting the Latino community. And when you talk about health disparities, we're talking about the social determinants of health. So the things that are predictive of our health outcomes, whether that's educational levels, economic, purchasing power, opportunities, health, where we live, the zip codes in which we reside, our exposure to different environmental factors along those lines. But we're also talking about our exposure to climate threats. And so whether you're working outside, whether you work with a lot of chemicals, with the food that we eat, and what type of access you have to good, healthy foods that are rich in nutrients. These are factors that all come together. And for me, from my perspective, the climate crisis is a health crisis. Again, our abilities to go out and to work, to be able to provide for our families are really impacted by not just workplace safety, it's not slipping and falling on a wet hallway, but if we're out working outside in the sun, if we are when folks are having the opportunity to telework, and some members of our community don't have that choice, don't have that privilege to be able to stay home and telework for a day. These all come to bear in the health outcomes that we see, that we know and that we hear about from the community here in Montgomery County. I think that the community, Latinos in particular, and many county residents are passionate about the environment, about climate change, about doing something about it. So again, those factors intersect all over the place in my eyes. And so for one of the things that we're trying to do is to bring awareness to the intersection of climate and health.
Well, I encountered the Latino Health Initiative all over in Montgomery County, wherever I go. Will you just tell me how it's structured and what your particular role is? Your title is program manager, is that right?
That's right. That's right. So we're a team of about 15. We are part of the Department of Health and Human Services. We have two, I guess, primary branches, if you will. One is focused on community programs and initiatives in the community, workshops, engaging directly with the community. We also have an arm that focuses on the foreign health training foreign trained health professionals so that they can immerse themselves in health profession work here in the county. And then besides that, there's a lot of advocacy work that we are involved with, and being part of, again, along with other health initiatives and programs targeting the African American community and Asian American community. That's sort of our task to address health disparities impacting vulnerable communities.
Well, look, thank you for everything that you do and all of the great work that the Latino Health Initiative does. We're delighted to have this opportunity to recognize you, and you get a closing word if you've got anything you want to say.
No, thanks again for having me here today. I think that I'm humbled by this honor, but really I'm here as a sort of mouthpiece for my colleagues, all the great partners that we have in the community, and mostly our community health workers who are the front lines of all of our efforts here to promote health and wellness in the county. You may see them when you're out and about in the county, but oftentimes they go unrecognized, unheard. But trust me that they are extraordinarily vital to the work that we do here. That's how we know what those service gaps are in the community, what the community needs are, how programs and services that are trying to help are being received, any challenges and barriers that folks are encountering. We hear about them, those kinds of gaps and barriers from our community health workers, our health promoters, or promotoras de salud, as we say in Spanish. And so really, I'm here on behalf of them, on behalf of my colleagues, to be here with you on this occasion. Thanks again.
Awesome. David Del Pozo, our local hero. Thanks so much.
Thank you.